I'm Staci Simmons. I'm the DNP Program Coordinator at Capstone College of Nursing here at the University of Alabama. I'm joined today by my colleague, Dr. Amy Lee.
I'm Amy Lee. I'm the Associate Dean for Graduate Programs at the Capstone College of Nursing.
We're delighted that you've joined us today as we provide an overview of the key strategies for successfully publishing your DNP project. Publishing my DNP project has been one of my proudest accomplishments.
Not only was I able to publish my DNP project, I was also able to publish a follow-up study based on my DNP project. Let's dive into some practical tips that can increase the likelihood of your project being accepted for publication.
I don't know about you, but getting started is often the hardest part for me. Many new graduates hesitate because they lack confidence or just don't know where to begin.
Absolutely, the process can be daunting. It's okay to take a break after graduation, but don't lose momentum.
Set a deadline for submission and stick to it.
Don't forget your mentors. Seek out guidance from those who've been successful with publishing. Invite someone to co-author with you.
Choosing the right journal is essential. You'll want to pick one that aligns with your project's topic, scope, or practice area.
After picking a journal, read some articles to see what they accept.
Important tip, don't submit your student manuscript as is. Revise it to match the journal's guidelines, which differ from faculty assignments.
Follow those submission guidelines closely, including word count, formatting, and reference style. Many papers get rejected for simply not meeting these basic requirements.
Focus on your abstract. This is often the first thing that reviewers and editors see. Make sure it's clear, concise, and highlights the relevance of your project. The abstract is your chance to grab their attention, so make it count.
Next, highlight the clinical relevance of your project. Editors look for work that addresses real healthcare problems and can drive tangible change. Clearly communicate how your project tackles a significant issue.
That's right. For example, if your project reduces hospital-acquired infections or improves patient safety protocols, explain how these changes led to better patient care.
Be specific about your outcomes and their real-world benefits for providers or patients.
Now let's talk about strengthening your manuscript. Ensure that it is logically organized and adheres to the journal's author guidelines.
Absolutely, Staci. Follow a clear structure: introduction, methods, results, and discussion. This helps reviewers navigate your work. A strong literature review is also crucial as it underscores the relevance of your project.
When presenting your results, be specific and support them with data. Including tables, charts, or diagrams can make your findings more compelling and easier to understand.
Polished professional writing is crucial. Use a clear tone and avoid overly complicated sentences. Proofread multiple times to ensure your manuscript is error-free.
Ask mentors or colleagues to provide feedback. And find out if your institution offers a formal review process. Here at the Capstone, we have an internal review process that is a great source for providing pre-submission feedback. When presenting your project, it's essential to emphasize how it contributes to the field.
Journals are always on the lookout for manuscripts that offer something fresh or innovative.
Ask yourself, does my project address a gap in the literature? Identifying what sets your work apart will help make a compelling case for why it's worth publishing.
Highlight how your project brings something new to the table. Journals are more likely to accept a manuscript that demonstrates a clear, evidence-based approach to improving clinical outcomes.
DNP scholarly projects often emphasize quality improvement. Highlight this in your work. Using recognized frameworks can strengthen your methodology and boost your chances of journal acceptance.
Show clear outcome data demonstrating measurable improvement in healthcare quality or patient outcomes. Clinical significance is just as valuable as statistical significance. And there's no need to specify that your project is a DNP project.
Rejection is common in academic publishing, so be prepared to revise. Manuscripts are rarely accepted on first submission, and that's okay. If rejected, use the reviewer's feedback to strengthen your work.
Take your time to revise and resubmit. Persistence is key. If you're asked to make revisions, that's a positive sign. Follow the reviewer's suggestions carefully, meet the deadline, and resubmit with confidence.
Improving your chances of getting published requires a thoughtful, strategic approach. Find a mentor. Consider inviting someone to co-author with you.
Choose the right journal, write a compelling abstract, and highlight clinical relevance. Polish your manuscript, be persistent, and seek feedback. Publishing is crucial for your career and advances nursing practice and healthcare.
Thanks for joining us today. We wish you great success in getting your DNP project published.
Thanks, Staci.
Thanks, Amy.